a frequent flyer, are you at a venous thromboembolism risk? Venous thromboembolism does not discriminate by age, race, or gender. Anyone can be affected under the right circumstances, even if they are otherwise healthy and active. Many celebrities, internationally and prominent Indian personalities have received treatment for venous thromboembolism. As per many published data, venous thromboembolism is no longer a rarity in India. What is venous thromboembolism? If blood moves too slowly through your vein, it can cause a clump of blood cells called clot. When a blood clot forms in a vein deep inside your body, it is called deep vein thrombosis. This is most likely to happen in your lower leg, thigh, or pelvis, but it can occur in other parts of your body too. If a blood clot breaks free and moves through your bloodstream, it can get stuck in a blood vessel of your lung known as pulmonary embolism that can even cause sudden death. Deep vein thrombosis may show certain symptoms or may be symptomless. DVT symptoms are leg or arm swelling that comes on without warning, pain when you stand or walk, warmth in the area that hurts, enlarged vein, skin that looks red or blue. Pulmonary embolism symptoms include shortness of breath, chest pain that's worse when you take a deep breath, and coughing up blood. What might put you on venous thromboembolism risk? Venous thromboembolism can happen at any age, but your risk is greater after age 40. If you are obese, having BMI over 30, if you are pregnant, carrying baby puts more pressure on the veins in your legs and pelvis. Post-delivery, up to 6 weeks, there is a risk of clot development. Certain inherited blood disorders that run in families can make your blood thicker than normal or cause it to clot more than it should. If you have suffered any trauma, injury to a vein can cause clot formation. Are you at bed rest or hospitalized for a long time? In this situation, the leg cuff muscles are inactive, so there is a chance to develop clot in deep veins. Serious health issues can raise the risk like irritable bowel disease, malignancy, and heart disease. If you smoke often, your blood cells will be thicker than they should be, and lining of your blood vessels will be damaged. This makes it easier for clots to form. If you are consuming birth control pills, estrogen can raise your blood's ability to clot. Long flights or car rides can put you at risk. The cramped conditions while sitting and the restricted movement cause reduced lower limb venous return, resulting in thickening of the blood, which is further aggravated with low cabin air humidity, hypobaric hypoxia on commercial aircraft. To avoid venous thromboembolism to happen to you, you can follow some simple tips to keep blood circulating the way it should. Simple lifestyle changes like quit smoking, lose weight, healthy eating. If you are at desktop job for long hours, take a break in between. Do some stretch exercise, walk through the office corridor, keep yourself well hydrated. If you are on long car drives, take a break and pull over every 2 hours to stretch the calf muscles. In case you are traveling by flight for your international trip or domestic trip with one stop layover and also frequent continuous traveling, ensure certain important precautionary steps. Wear loose-fitting clothes, drink plenty of water. Excess intake of caffeine, alcohol, and salty snacks can have dehydrating effects, so better you limit. Do not sit for too long. Walk up and down the aisle whenever permitted. You can follow some recommended air travel exercises and can repeat every hour when you are away. Neck roll. With your shoulders and arms relaxed and hanging down, tilt your head to your left, hold for a few seconds. Then slowly roll your head towards your back and hold for a few seconds. Then slowly roll your head towards your right shoulder and hold for a few seconds. And then slowly roll your head towards your chest and hold for a few seconds. Repeat this exercise for a total of 5 times clockwise and 5 times counterclockwise. Shoulder roll. While in your seat with your arms on the armrest, move both shoulders in a circular motion from front to back 5 times and repeat in the opposite direction. Shoulder stretch. While in your seat, put your left hand on your right shoulder. With your right hand, grasp your elbow and pull your left elbow towards your right side. Hold this position for 15 seconds, then switch arms and repeat the stretch with the opposite side. Repeat the stretches 5 times with each arm. Knee to chest stretch. While in your seat, lean forward slightly and grab your knee just below the joint. Slowly pull your knee towards your chest and hold for 15 seconds. Repeat the stretch with your other knee. Repeat the cycles 5 times. Ankle circle. Raise your feet off the floor and rotate them in a circular motion 5 times clockwise and then 5 times counterclockwise. Foot palms. With your heels on the floor, first raise your toes as high as you can and hold that position for 10 seconds. Then lower your toes until they touch the floor and then raise your heels off the floor as much as you can, keeping your toes on the floor and hold that position for 10 seconds. Repeat this exercise 5 times. You can also put prescribed anti-embolism stockings which will squeeze and stimulate circulation in your calves and feet by applying pressure. But ensure proper medical brand to avoid any negative tourniquet effect, bruises or skin rash. Hope this video is an eye-opener and helpful guide to you. In case you suspect to fall under any risk category or develop any symptoms pertaining to venous thromboembolism, then seek medical consultation. Thank you for watching the video. Do take good care of yourself.